Hello, wonderful attendees. I'm your host, Dalvinder Kaur from Lovely Professional University. Get ready to dive into today's topic, that is understanding chemistry of herbal medicines. Before we proceed further, allow me to introduce the experts of the day. Dr. Charanjit Kaur, Department of Pharmaceutical Chemistry, School of Pharmaceutical Sciences, Lovely Professional University. Dr. Kaur brings nearly 11 years of experience and has excelled in prestigious national exams such as GATE, GPAT, MAT, and more. She has an impressive academic record with over 40 scientific papers published and 3 indexed book chapters. So now I would like to introduce the admission nominee also in this webinar, Mr. Chandan Agarwal, with 18 years of experience in career guidance and counseling. Mr. Chandan oversees outreach initiatives across Punjab and leads the call center team, driving admissions and enhancing the university reputation. Before we proceed further, in today's session, I would like to request everyone for any questions you can write in the chat box or in the Q&A box, and same will be addressed from my side in the end of this webinar. And now I hand over the things to Dr. Charanjit Kaur, and it would be an absolute delight to listen from her. Over to you, Dr. Charanjit Kaur.
A very good afternoon to all the past participants and greetings from Lovely Professional University and School of Pharmaceutical Sciences. Today I'm going to discuss understanding the chemistry of herbal medicines. So starting with the introduction part, what are the herbal medicines? The herbal medicines are the medicines obtained from the medicinal plants, which are the basic source of traditional medicine since ages in Ayurvedic, homeopathic, and Unani therapy. A medicinal plant is any plant or its parts which contain substances that can be used for therapeutic purposes or which are precursors for the synthesis of useful drugs. So what are the drugs actually? Any molecule or any entity which is producing the pharmacological or therapeutic action in the body. According to World Health Organization, 80% of the world depends on herbal medicine for primary health care. These medicinal plants are source of natural products that can be developed into novel drugs or can be utilized as drug leads. A large or indirectly from plants. So what are these drugs? These chemical entities present in medicinal plants which are responsible for pharmacological action are called as phytochemicals or phytoconstituents. Phyto, as they are obtained from the natural resources or the plants, and chemicals because these are chemical entities. Now, the development of new pharmaceuticals for a wide range of medical conditions has long relied on the identification of these natural drugs. There are over 60% of cancer, infectious illness, and CNS disease medications that include natural product pharmacophore. So what is pharmacophore? Any molecule, the part which is responsible for binding with your target and produce the pharmacological action is called the pharmacophore. More than 70 new medications for a wide range of illnesses such as pain, dry cough, opioid addiction has been discovered as a result of medicinal chemistry investigation into this conventional natural product pharmacophore. A stunning example of power of medicinal chemistry tools in the exploration of these phytoconstituents or chemical entities present in the plants is the morphine, which has shown and create a library of bioactive molecules which are effective for the treatment of various illnesses. So coming to the morphine and its analogs. Theophrastus in the 3rd century BC mentioned opium poppy juices as an analgesic agent. And in the 10th century AD, Rhazes in Persia introduced opium pills for coughs, mental disorders, aches, and pains. What is this opium poppy? It is Papaver somniferum that contains phytoconstituent named morphine. That is the potent analgesic agent. The analgesic agent means any molecule which relieve any individual from the pain. And its derivative, codeine. This is the morphine, and this is the structure of the codeine present in the opium or poppy. This codeine is the derivative of morphine by replacing this hydrogen with the methyl group. So by replacing this hydrogen with the methyl group, the properties of this molecule changed as cough suppressant. So these leads for the further derivatization of the new molecules such as oxycodone. Similarly, coming to the next example of quinine, that is the phytoconstituent present in the plants, and they are used since ages. In 1963, a monk called Kelanka, who accompanied the Spanish conquistadors to Central and South America and introduced one of the greatest herbal medicine to Europe upon his return. The South American Indians would extract the cinchona bark and used it for chills and fevers. The European used it again for the same and for the malaria. In 1820, the active constituent isolated from cinchona bark was determined and named as quinine. So this is again the chemical entity, and it acts as anti-malarial drug, as antipyretic and analgesic as well. Similarly, Digitalis purpurea is the plant commonly called as foxglove. So in the ancient time, it was used by Fuchsius in 1542, and before that, Welsh physicians cited the use of foxglove plant in 1250. It was introduced for the treatment of edema, which was then called as dropsy, in 1785 by Withering. The phytoconstituents or the chemical entities determined from Digitalis purpurea and its another species Digitalis lanata, they were digitoxin and digoxin. These are very important drugs for the treatment of congestive heart failures. Next example of the chemical entities present in the Revolvia serpentina is rezapine. This is antihypertensive drug which was extracted by ancient Hindus from snake-like root of Revolvia serpentina plant. It was used for the treatment of hypertension, insomnia, and insanity. Insomnia is the term used for lack of sleep. Similarly, another example of herbal product that has been extracted from the plant is bisabolol. This is the phytoconstituent chemical entity present in chamomile, which is commonly called as babuna. The herbal product is derived from plant Chamomile novae. This chemical entity bisabolol, it has been observed to exhibit anti-inflammatory effect. Another phytoconstituents present in chamomile includes luteolin, apigenin, chemazoline. These constituents also exert anti-inflammatory effect, which is comparable to that of indomethacin. Indomethacin is a synthetic drug which is commonly used for the inflammation. Chemazoline, this phytoconstituent with the structure shown, has anti-allergenic and anti-inflammatory effects. The garlic is the most commonly used in the household, and it is called as Allium sativum. It is one of the most commonly used herb used in the cooking and in the medicine as well. the phytochemical present in the garlic is allene. The garlic releases the enzyme alliinase when the tissue is damaged. So this allene, it is converted to allicin. The structural change includes the removal of this group amino and introduction of the sulfur group here, which changes the properties of this molecule. So this is organosulfur, as sulfur is present in this molecule allicin, and this is responsible for distinct odor of garlic. This molecule is potentially known in the literature for its anti-cancer, anti-protozoal, antifungal, antibacterial, and antiviral activity. The next herbal product or the plant from which we get phytoconstituent is St. John's wort. It is commonly called as Bassani. It is obtained from Hypericum perforatum. This plant is used to treat conditions such as depression and anxiety. Now, how this plant is able to exert its effect in depression or anxiety? This is because of the presence of these phytochemicals, hypericin, noretheriol, and camphorol. These molecules are also widely known for its antioxidant activity. Next natural product is muletti or licorice. It is the herbal product derived from the root of the plant Glycyrrhiza glabra. It has been documented in the ancient Chinese writing and was actively used in the Roman Empire as well. This herb contains compounds such as sugars and triterpenoids, but the main triterpenoid present in this is glycyrrhizin. The root of this plant contains 9% of this phytoconstituent and is responsible for anti-inflammatory activity, anti-ulcer activity, and antiviral activity. Glycyrrhizin has also been documented as effective in the hepatitis C in the Japan. Next natural product or the medicinal plant is rhubarb. Rhubarb roots, they are commonly used in the Chinese herbal medicine as laxative. Laxative word is used for any medicine that relieves the constipation. The root is rich in cathartic and laxative anthraquinones such as rein-imodine. These two phytoconstituents, they act as lead compounds for the design and development of dendron. This has been used as laxative based on the structure of these two phytoconstituents. Now, what is the general methodology that is commonly used for any phytoconstituent isolation from a plant? First, the plant is collected and it's identified based on the literature and the repository data. Then the plant part which is collected, it is crushed and macerated so as to obtain the fine powder after drying. Then this crushed or macerated or grounded part of the plant is extracted with the help of the solvent. Then after solvent partitioning, this extract is used to isolate the phytoconstituent by using column chromatography after reducing the volume of the extract. When column chromatography is used to isolate particular phytoconstituent, they are identified by different spectroscopic techniques. Preparative HPLC is used as one of the methods if we have the data regarding the retention time and peaks from the repository. If the data matches with the already existing molecules, we came to know about the phytoconstituent. If the molecule is new, the structure can be elucidated by using various spectroscopic techniques like NMR, nuclear magnetic resonance, GCMS, if the molecule is volatile in the nature, and mass of those fragments can be determined. C spectroscopy, circular dichroism, FTIR, infrared spectroscopy, and high resolution electroscopy, ionization, mass spectrometry. All these techniques, they are used to elucidate the structure of the phytoconstituent that is present in the plant, and by isolating the phytoconstituent, we come to know that the activity of the plant resides inside that phytomolecule or any other. Now coming to pharmacokinetics. So after isolating the molecule, we have to check whether the molecule will be able to get absorbed, distribute, metabolize, or excrete or not. This is the example after ingestion of the molecule inside the body. If suppose we take the example of morphine or its derivatives, it interact with the targets. Targets can be receptors, enzymes, or any protein molecules. As we know, the protein molecules, they are made up of amino acids. They work on the basis of lock and key hypothesis or induced fit hypothesis. Whenever molecule after absorption get distributed and reach the target organ, where in the membrane receptor or enzymes are present there, molecule can interact and fit into the pocket of the protein and interact with the amino acids present inside the protein. This method or this interaction is based on the complementarity. Better the fit, more will be interaction. Now, the interaction of the molecule with the amino acid, it is dependent upon different type of functional groups present on the molecule as well as the functional groups present on the amino acid. As you can see on the screen, the morphine structure is interacting with the amino acid histidine and tyrosine and aspirin and valine. These amino acids contain the functional groups, amino group, carboxyl group, or in some cases, in case the structure is different, the fit will depend upon the interaction of the functional groups of the molecule or the drug or the phytoconstituent with the amino acids present on the active site of the receptor or enzyme. More the interaction, better will be the fit and better will be the therapeutic potential. Coming to how these molecules interact and produce the action, I have taken the example of morphine. In case of the morphine, these molecules act on the opioid receptors. When the morphine bind to these opioid receptor, they inhibit the conversion of ATP to cyclic AMP by the enzyme adenylyl cyclase. When there is decreased cyclic AMP, there will be decreased calcium influx inside the cell. When there is decreased calcium influx inside the cell, there is decreased release of neurotransmitter. When the neurotransmitter release is less, then the analgesia is produced. This is how the phytochemicals, they interact with the various receptors. Interactions I have shown in this slide at the amino acid level. And this is how different phytochemicals, by their chemical interaction, depending upon hydrogen bonding, covalent interaction, ion dipole interaction, dipole-dipole interaction, hydrophobic interactions, depending upon their structure, produce their pharmacological effect. Now, what is the entire journey of any phytoconstituent or medicinal molecule inside the body? If we are considering the phenolic compounds, any molecule which are obtained from the natural resources, they are first extracted, and these phenolic compounds, they may be ingested in the body through microcapsules, nanocapsules, or any other dosage form or they may act as a functional food, dietary supplements, or as a medicine. When we take these molecules through the mouth, they reach the stomach, then the intestine, and they get disintegrated and dissoluted. Then they enter pre-systematic blood, they reach the target tissues. On the target tissues, they produce anti-mutagenic effect, antiviral effect, antioxidant effect, or any type of effect they are intended to produce. After that, these molecules, they are metabolized in the body so as to convert into the non-toxic derivatives and polar derivatives so that can be excreted out of the body through urine. So the herbal medicines or the natural products, they produce effects because of their chemical entities present in their extracts or plants, and these entities, they interact in the similar fashion with the protein molecules, which are receptors or enzyme, and because of this chemical interactions, they produce a particular kind of effect through stimulation or inhibition of particular pathway inside the body so as they can be used as medicinal agents. That's all. Thank you.
Thank you so much, Dr. Charanjit Kaur. So now I would request to the admission nominee, Mr. Chandan Agarwal, to be on the screen. Over to you, Mr. Chandan Agarwal.
Yes, ma'am. Very good evening, everyone. I hope my voice is audible. I'm sharing my screen. Just one moment. I hope my screen is visible to everyone.
Yes.
So I'm starting. As already ma'am has shared so many things related to our university. So before proceeding further, I would like to share the gist about the university rankings and other things that our university is having. So there are certain accreditations and approval proudly saying our university is approved from NAC A++ grade on the 4-point scale. We scored highest, that is 3.68. Similarly, for each and every department or discipline, we have a required approval. For example, if we talk about the pharmaceutical itself, we have approval from PCI, Pharmacy Council of India. So similarly, not only these, you can see we have so many other approvals too. These are certain memberships that we are having. And for any university, it is a very important point that how well the placements are. So proudly saying our highest package went up to 3 crore rupees in Germany. And there are domestic packages and which went up to 64 lakh. You can see a few placements, star placements from our university. Not only this, you can see university is also having a very good rankings in certain departments where we can see it's these are certain rankings. Not only the rankings, we are also excelling equally good into the sports activities. You can see extra co-curricular activities and sports activities. We have not only nationals, but up to Olympics level gateway we provide to our students, right? So we all know these renowned faces, right? Neeraj Chopra is there, and then Bajrang Punia. These gold medalists belongs to the LPU, right? So not only this, you can see these few renowned personalities who visited our LPU campus. Everybody knows these faces. These are the well-known faces of the universe. You can see these renowned faces. They used to come to our university for their promotions. So it's overall very happening campus. So not only academics, but yes, the each and every approval that we require that have. And apart from studies, we are doing very good in sports, co-curricular activities, and overall it's a very happening campus. You can see this is an internal view of the auditorium. This is an internal view of the library, and this is an iMac lab where Apple systems are installed. You can see this is another view of the library. This is the outer view of the shopping mall present within a campus. This is an inside view of the campus, inside view of the shopping mall, sorry. So this is a gymnasium inside the mall, bowling court. We have 50-bedded hospital available within a campus, right? So perhaps we are providing Asia's largest residential facilities, which is around 21,000 students are staying within a campus. These are the certain views of the campus at different timings. Night view of the campus, tennis courts, archery, you can see Olympics level swimming pool is there. Indoor stadium, outdoor view, out view. These are the, let's go live now. I'll show my screen how one can apply to our university. Just one second. Here. So our official website is www.lpu.in. Once you open this website, this this web page will open up. Once I go on the admissions part, I need to click on the regular programs. If I am looking for UG programs, I need to click under the after 12. If I am looking for the PG programs, then I need to click under the after graduation program. Here I am just showing the example of how to proceed with the B pharmacy program. So I clicked on this regular program. Here I need to click on the pharmaceutical sciences. You can see B pharmacy program is there. So I have already opened this. This page will open up as soon as I'll click on the B pharmacy. It starts with the eligibility. Eligibility says that one must have studied in 10+2, bare minimum 60% marks is required. And then English, physics, chemistry, and out of math or bio, one subject student must have studied in 10+2. And then there is a one entrance exam with the name of LPU Nest, which is our own entrance cum scholarship test, which one should need to qualify. If somebody is having a good score either in CUET or in NEET, we are also considering these national level exams for our admissions. In that case, the LPU Nest will become optional for scholarship. Moving further, if I talk about the fee structure, we are already into the phase 3. So our basic fees is 1,20,000 per semester, but don't worry, no one is need to pay this much fee, because in this, if somebody is having 80 to 89.99% in their 10+2, then this scholarship, this 15% scholarship will be applicable, and applicable fee would be in that case 1,02,000. And similarly, if in LPU Nest, somebody is able to score 140 to 150, which is tentative marks out of 400, even then this scholarship will be applicable. Similarly, for second category scholarship, 90 to 94.99% is required in 10+2, or if somebody is having not that much percentage, but in LPU Nest, somebody is able to score tentatively 200 marks out of 400, then 20% scholarship would be given per semester, and applicable fee would be 96,000 in that case. And similarly, for 95% or above, 25% scholarship. And in LPU Nest, if somebody is able to score 300 tentatively, then they'll be eligible for 90,000 fees only. Once, if anybody is getting any scholarship, that will be applicable for all 8 semesters. That is a big thing. So how one can apply? There is a one button here. You can write down the details, fill these details and submit, and you will be routed to the admissions.lpu.in, this one. So once you submit the application, then you can directly reserve your seat first in the phase 3 by paying 15,000 rupees, and last date is 25th of July for this phase. So do apply as soon as possible, and then from the same dashboard, you can apply for LPNS for scholarships, right? And then you need to report to our campus. Our reporting is already in. Thank you so much, and that is it from my side. Thank you everyone for paying attention. Thank you, Dalvinder ma'am.
Thank you so much, Mr. Chandan Agarwal. Can we take a question? So Mr. Chandan Agarwal and Dr. Charanjit Kaur.
Yes, ma'am.
Thanks for giving me a chance to address your question. Now let's start with first question. Megha is asking here, how do the chemical constitutes of herbal medicines interact with the human biological system to produce therapeutic effects?
Hi, Megha. As I told in my presentation, if we consider about any molecule, say morphine, they interact with either the receptors or the enzymes. depending upon their mechanism of action. Have you heard about lock and key hypothesis about the enzyme? If it is an enzyme or receptor, the molecule will go and bind with the receptor or the enzyme because both are proteins.
Sorry for the
Now,
interruption, ma'am. Can
say,
you please switch on your video?
oh, sure.
Yes.
Uh,
You can continue.
okay. I was talking about when the molecule reach the target site. So depending upon its mechanism of action, it would be either interacting with the receptor or enzyme. As both are proteinaceous in nature, we know that proteins are made up of amino acids, and amino acids, they have amino group and carboxyl group. And in some cases, if the amino acid is basic in nature, there will be two amino group, one carboxyl group. If it is acidic amino acid, two carboxyl group and one amino group. And if it is not of either nature, it can have functional groups like hydroxyl group and SH group as well. Now, suppose your molecule contain any kind of functional group which can interact with these functional groups either through hydrogen bonding or covalent interactions. Whenever interaction will be there between these functional groups of your drug molecule and the amino acidic functional groups present on the active site of either receptor or enzyme, there will be fit. Better the fit of the molecule in the pocket of the receptor or the enzyme, so then there will be better either inhibition or the activation of the receptor or enzyme. Depending on that, it will act as agonist or antagonist or inhibitor, depending upon whether it is acting on receptor or enzyme. If the receptor is activated, the entire pathway is stimulated, which will produce either the release of endogenous molecules inside the body that naturally produce a specific pharmacological action, or if it is acting as inhibitor, the release of those endogenous molecules inside the body will be inhibited. Suppose in a particular diseased condition or disordered state, whenever the natural balance of the secretion of these molecules, they are hindered, then these molecules which are you are taking from outside, they help to bring balance to that pathway. I hope you have understood. If still you have some doubt, you can ask.
Thank you so much, Dr. Charanjit Kaur. Mr. Chandan, someone is asking here, how are the placements done in a lovely professional university and what's the process?
See, for the placements, first of all, I would like to share, we have a personality development department. From the second year itself, students can register for the placements. There are different pathways. We ask the students to whether they want to opt for the placements or whether they want to go for the corporate jobs or the government job or for higher studies, right? So there are three pathways. So in that case, there the pathways as government jobs are there. If somebody is opting for that, we have added certain subjects according to that. Similarly, under the personality development, we are preparing for group discussions and trainings and placements so that at the end of in the final year, whenever the companies come for the interview, students won't find the hurdle for appearing in entrance exam or group discussions or interviews. First thing. Second, proudly saying in the Department of Pharmaceuticals, we already have 400 plus patents filed by us. So we are not only encouraging the students for going for the placements, but we are developing the culture of research so that they can get the better opportunity. If somebody is finding a better drug formulation, they can directly do the wonders by filing the patent. Regarding the placement package, I would like to share few things. Just give me a moment. I can share the exact figures also. For that, just give me a 30 seconds. If I talk about the B pharmacy particularly, then the high placement percentage went up to 88%. it went up to 88% last year, right? And out of 138 students, 122 students were placed, and rest of the students went for the further studies. And the highest package, that was a Intravitus AB7 subscribing and RCM Private Limited. They hired the students at the package of 8.4 lakh per annum. And most important, in the B pharmacy, the students got a drug license. They can open their own medicine store after completing the this B pharmacy degree from the lovely professional university, because we are PCA. Thank you.
Thank you so much, Mr. Chandan. Someone is asking here, tell me about the PhD related information. Mr. Chandan.
Ma'am, PhD admission, they want to know about the admissions, how to proceed with the PhD admissions.
Just this is the query. Tell me about the PhD related information.
Okay,
Yes.
I would like to detail about the how to take the admission in the pharmaceutical PhD in pharmaceutical sciences. So first of all, for any candidate who wants to apply for the PhD, they must have a if somebody is already appeared in the UGC NET exam, if they qualified that, we are accepting that too. Otherwise, we have our own test with the name of LPU Nest PhD. Unfortunately, the dates are over for PhD for this session. Now we will be taking the January intake, and then the forms will reopen somewhere in the month of October, mid or November 1st, right? So at that time, if somebody wants to apply, they can apply for the LPNS PhD exam. They need to qualify that exam. Once the exam will be qualified, then we will be taking an interview. Once the interview will be also qualified by the candidate, then they will be offered the seat in the pharmaceutical PhD pharmaceutical sciences. And there we are also providing the 3 categories of coursework. One is they can come by weekends, they can attend the coursework by every Saturday, Sunday, and the other option is 4 days in a month. And the most lucrative option that most of the candidates opt for, that is 15 days in a single go in the month of November or December for the course. So that is a brief gist about the PhD.
Thank you so much, Mr. Chandan Agarwal. And once again, thanks to our experts, Dr. Charanjit Kaur. As we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding admissions. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a beautiful day.